So my name is Charles Zelen, and I'm president of the Professional Education and Research Institute. We run clinical trials for venous leg and diabetic foot ulceration trials, also in clinical practice in Zelen, Virginia. The Foot Defender was one of our best additions to our armamentarium for offloading, because a lot of our patients really don't like the look and the feel of the regular offloading boot. They feel it looks like Darth Vader's boot or Herman Munster's boot. And the Foot Defender is designed so it's aesthetically pleasing and the patients feel more comfortable using it. And at the same time, it actually provides better offloading. In research, we have to have compliance, and the patients have to wear their boot. If they don't wear their boot, then they can be taken out of the study. And it's critical, for our success to be able to have all the diabetic patients stay in the study. And when you add Foot Defender in there for the standard of care patients or for the patients receiving the graft or medication or gene therapy, their compliance is much better. Foot Defender comes in a whole plethora of sizes. So whether it's a smaller lady who's a diabetic, or it's a giant Charcot foot on a 300 or 400 pound patient, all patients conform well with the Foot Defender, and all of them look at it, and to them it looks like a Nike, so they're willing to use it. So it really isn't a question of who's the best patient. It's all the patients, who need an offloading walker. The Foot Defender is the better choice. I have some patients that are doctors, and the doctors just aren't gonna wear a regular cam boot. So specifically, I had two that were surgeons that just refused to be compliant with the cam boot, and we would try to make diabetic shoes or something else work. But once we gave them a Foot Defender, they wore that all day long, and they even used it to operate. So it really made a difference in a professional's life who couldn't be in a handicapped-looking boot and wanted something that was aesthetically pleasing, but also managed the offloading well. To take a step above, we're starting one of our research trials with a large vendor in the United States, and we're adding on the Foot Defender with the Smart Boot. And to be able to have that ability to know that the patient's wearing the boot and also to know that the patient's being properly offloaded, that is a benefit even above and beyond what the regular Foot Defender offers. And you've done an amazing job, and we're going to continue to use Foot Defender in all our clinical trials, because you know what? It's better for the patients and it's better for the trials. All relatively normal legs we can fit in the Foot Defender. It's very easy to put on. You can instruct the patient how to use it. You can get really nice compression. So I don't really have anything that I would improve at all. I think you've done a fine job.